Listen, welcome, and I'm so happy to be in Los Angeles. Anyone from the Midwest would know why I'm saying that. I am all those things, but I'm something a little bit different as well before I introduce other people. I'm someone that's very excited about the future in healthcare, and if you had asked me that 5 years ago, I would have said exactly the opposite. I want people to embrace artificial intelligence and blockchain, not be frightened by it. AI isn't Star Trek, and blockchain isn't some crazy new idea. It really isn't. I have the feeling right now when I see before a couple of presentations about beyond deep learning and into reasoning, I really believe we can actually change healthcare. Just last point here, I wrote a PhD, not because I wanted to be an academic, because I was really annoyed. I'm annoyed that 300 people lose their life in this country on aviation problems, aircraft accidents, and most of them are crop dusters and things like that. And none of us would get on a plane if the pilot came out and said, hey guys, the autopilot's out, but I think I can land this sucker in O'Hare. I'd say, I'll take the next flight. But here we are with physicians. We give them 7 minutes to analyze, 5,000 disease states, and you better not, have a problem. So when I wrote the PhD, it was really this idea, 300 in aircraft, 40,000 in car accidents, and 250,000 from preventable medical death. So AI, all the stuff you're hearing about here, I would just ask you, please join me on my crusade, because it's going to change the outcomes. We wouldn't put up with this in any other industry. My son's a trader. When I go down to Chicago and see the artificial intelligence on the platforms about money, it's kind of embarrassing to me. So my personal crusade is to literally get people to understand and embrace artificial intelligence and blockchain. I'd like to go to the unbelievable panelists here, and I'd like this to be interactive too. I sit in plenty of these audiences and I think, when is that guy with that funny accent going to shut up? I want people to actually ask questions and engage. Don't be frightened if you say, what is AI? What actually is deep learning? Because this is nowhere, the mathematics of Bayesian and things like that, they are complicated. But the concepts are nowhere near as complicated, especially blockchain. So I just want to hand over to our panelists, and I'd love you guys individually to introduce yourself and introduce what's your background, AI, IoT, and what you actually would, what your passion, why you get out of bed in the morning. Thank you.
Good morning. Hello. Hi, good morning. My name is Wang. I'm a co-founder and CTO of a startup called Zingbox in Silicon Valley. We use artificial intelligence, deep learning to protect medical devices. And we started in 2014. We were incubated out of Stanford University, and now we're deployed in many mid to large size hospitals across the United States.
For those of you who know me, I can speak forever, so I'll briefly just introduce myself. My name is Sajid Ahmed. Up until very recently, I was the Chief Information Innovation Officer for the brand new Martin Luther King Hospital that is approaching its 3 years. And my friends, where are my friends from MLK? If you're from MLK, raise your hand. That's right. Give them a hand, guys. It is the second busiest ED in LA County, and it's a state-of-the-art hospital, and took team effort to do. Prior to that, I was with LA Care Health Plan, and my friends from LA Care Health Plan are here too. Woo! There you go, Tom. And there's a couple others. I'd also like to just mention what I'm doing now. I'm CEO of Wise Healthcare. We provide artificial intelligence technology and services, virtual care, and workflow engineering. Two of my colleagues here, Dr. Frencher, Wahid, who are helping me out with that endeavor, along with our staff in AI. My quick background is, for me, this is a bit of a homecoming. I'm a champion with you to support AI. I was an AI programmer 25 years ago, and when you said AI and healthcare in the same sentence, they thought you were crazy. So we hid those words and said, oh, we do decision support. So it's really good to see AI come back, and look forward to telling you guys more about the work in AI.
Thank you, Sajid. So my name is Neeraj Bhavani. I'm the founder CEO of a company called Tagnos. My background, I worked for Kaiser Permanente in the healthcare informatics space many years ago. Went to UCLA for my business school. This company, Tagnos, was seed funded by UCLA Foundation. What we do is we track patients in the different service lines of the hospital, ED, OR, radiology, cardiology. Basically, when the patient and the family are parking their car in the parking lot and they hit the admitting window to the point where they are done with the procedure and going back home, or they're getting admitted to the hospital, right at the very front, they go through about 6 to 8 steps, like waiting before registration, registration, waiting after registration, pre-procedure, procedure, PACU recovery, transfer. All of that tracking today is being manually done. And so there's a lot of inefficiencies around the service touch points. And so what we do is bring in all the coordination and collaboration on the service touch points. And the biggest ROI for the hospital is that we can reduce the cycle time or the departmental length of stay, and the patient and the family gets all the improved engagement. We just got venture backed about 45 days ago. We raised $5 million in venture capital money. It was led by a VC in Palo Alto, syndicated by a fund in Sherman Oaks right here, and Zebra, which is a corporate in Chicago. We were incubated by Cisco, so Cisco is also joining the investment round. We had about 10 employees last year. We are up to 14 now. We hired our head of sales, Mac, who's in the room right here. And then we have a marketing person, Jessica, right at the back, recording all the videos. So there's a lot of energy now in the company. You know, we're ramping up the team. We're at 10 hospitals, Keck USC, Adventist Health, 5 of the Providence St. Joseph Health Hospitals, Salinas Valley, MedStar in Washington, D.C. So we're trying to scale the team and basically go after the market in a big way. Thank you.
Good morning, everyone. My name is Sumeet, Bhatia. I'm the founder and CEO of a company called Aiva. And prior to starting Aiva, I was a co-founder and CTO of a company called TigerText, which does secure messaging in healthcare. So at Aiva, what we're doing is we're taking virtual assistants like Amazon Echo and Google Home. Many of you might have one of these devices in your home. And in addition to providing entertainment and information, we're taking those devices and putting them into clinical settings. So everything from hospital to skilled nursing, assisted living, ambulatory, all the way back into the home. And we're leveraging those for, as I was saying, entertainment and information, but also to connect you to your care team. So you can make requests like, I'm hungry, or I need to go to the bathroom, or I'm cold, and we will route that request to the most appropriate caregiver and let them respond back. So one of the things, our mission there is to leverage, from an AI perspective and an IoT perspective, leverage the natural language processing and decisioning and routing requests to the most appropriate person. Because ultimately, we don't want to bother an $85 an hour RN with a request for a blanket or Jell-O. Those things can go straight to the appropriate people who can handle those. We were most recently part of the Techstars Cedars-Sinai Accelerator, and that's if anybody has a startup in the room or is thinking about doing that, I can't recommend it highly enough. It's an absolutely incredible program with incredible people. And we've been very fortunate to participate in that program, and we just launched at Cedars-Sinai a couple of weeks ago. So look forward to this panel. Thank you.
Well, sorry, looks like it is working now. Thanks a lot for that. I think that what I'd like to do now is essentially move over to the challenges. So when I look at this, I hear all these companies. I hang out in Palo Alto as well. I went to JP Morgan. I came away thinking, oh my God, we're going to fix healthcare, you know. The challenges are that everybody here in the organizations and all payers or providers, all of us are on this side. I'm trying to understand from each of you, what challenges have you found with this very logical set of software and solutions you've got? What challenges have you found out there in the market, and how are you overcoming them? I'll just start this off with, in my own case, I've got these two platforms, one's for differential diagnosis, right? Totally logical. You think, obviously we'll go to market, the doctor will have a little thing up in the corner that will say, hey, don't send that patient home, they're going to get AF and stroke. So you think, oh, we'll just go and hook that up to an EMR and it'll all be great. The reality is it doesn't really work that way. The logic doesn't work that way. I wish it did, it just does not. We've got all these illogical EMR systems that frankly are episodic, not longitudinal, and yet we're all over here in AI world. I'm trying to understand from you guys what I've found, sadly, whether it's real or whether it's right or wrong, unless there's something that's actually has to be fixed, nothing happens, right? So how have you overcome the challenges of having these incredible technologies, deep learning, reasoning? How have you actually overcome that to get into the marketplace? And I guess explain to people how important this stuff is.
Well, Zingbox focuses on protecting medical devices because we found new challenges of all these medical devices. During the past several years, actually in healthcare industry, we did an excellent job of connecting everything, including connecting all these medical devices with your EHR system, with the doctors and patients, etc. But at the same time, healthcare has been the most hacked industry 3 years in a row, more than financial industry. So at the same time, all these medical devices, all these we call IoT devices are bringing us lots of benefits. At the same time, they are creating lots of vulnerabilities. I just give you an example. My dad unfortunately has stroke, and now he's staying at a rehab center. And at the rehab center, of course, it's a very nice, with very nice staff and very well served staff, rehab center. But the facility is actually relatively old. It has been around many years. So they have these clocks, the same as the clocks we have on the walls. And you can imagine every year, at least twice in a year, whenever the time changes, the staff has to physically climb up the ladder and change the clock. And they have hundreds and hundreds of rooms. And just imagine the amount of work. While at the same time, lots of hospitals Zingbox works with, they already changed these traditional clocks into IoT devices. They are network-connected clocks, so that automatically, when there's a time change, all the clocks are not only synchronized, but can change automatically. So that saves huge amount of effort and resource and burden on human beings. So that's just an example of the benefit of these IoT devices. When we talk about IoT devices, we define they're the devices that are purposely built for a fixed set of functionalities. For example, X-ray machines, your bedside monitors, IV pumps, and all these. So those are medical IoT devices, and they're also digital printers, digital clocks, etc., digital door locks, and those are non-medical IoT devices. So they're bringing us tremendous amount of efficiency, can save us cost, increase revenue, but at the same time, we found there are three main challenges of all these connected IoT devices. We call them ISO. So I stands for inventory. So when we go to a hospital, we ask the executives there, do you know how many devices you have? What kind they are? And especially at any certain point, do you know what devices are connected onto your network? And most of the time, the executives don't have any clue. And several hospitals are saying, oh, we've been facing this problem for a while and we've been looking for a solution, and right now the tool we're using is called spreadsheet. And we got a spreadsheet from IT department, we get a spreadsheet from clinical engineering. Of course, these two spreadsheets don't match with each other. And after our software using artificial intelligence came in, and within 24 hours, we often can show them twice the amount of devices they have on their spreadsheet. So the first thing we think very important for each organization to know is inventory. Another example, we all know last year there are lots of hacking incidents targeted at not just the data leakage, the patient's privacy, but also targeted at these devices. And lots of hospitals have been impacted. And one really large hospital we talked to, they said, actually, we have pretty good idea about what devices we have, but what we don't know is, at certain point, what devices are being used and connected. So we know we have devices got affected. We want to shut down these devices, but we don't know which one of them is now being used in operation, in surgery room, in ER room. Because if we shut down them, we can actually kill a patient. So that's something very important for each organization to know. Not only know about your inventory, but at any time, what devices are actually connected onto your network. So that I, inventory, stands for I. S is, of course, security. As we all know, there are lots and lots of vulnerabilities among these devices, and they can be a low-hanging fruit, they can be a stepping stone. Not only they can get into your critical patient records, but also they can interrupt your operation. They can, and in healthcare, that means safety, patient safety and quality of service. And the third one, ISO, O is for operation. And right now, we actually have very limited visibility of how these medical devices are operated and what the efficiency. And the good thing about all these IoT devices is all of a sudden they're collecting huge amount of data that we couldn't get before or we couldn't get in such real time. So there are lots of opportunities for us to leverage this huge amount of data to give operational insights for us to reduce cost and increase revenue. For example, about procurement. Every hospital every year buys hundreds of more IV pumps, but actually our data shows from all these large deployments shows there are lots of existing IV pumps are being idling most of the time, and they're not being used. So are there ways we can leverage the existing pumps before we get new pumps? And another way we can get operational insights is maintenance. For all these medical devices, we not only buy the medical devices, but we buy the service package, just like our cars. But right now, because we don't have a good information about the usage of these medical devices, we just do the maintenance every year, every half year, et cetera. But actually, there's a huge deviation among these devices. Some of them are being used really heavily. Some of them have been idling most of the time. So we can actually leverage these data to determine when this car, when this device really needs a service, because service can be really expensive.
Yeah, thanks very much. We'll just move along. Just in the interest of time, maybe if we talk a little bit about the challenges, but maybe your wins. Otherwise, we all have plenty to say if you hadn't figured that out, so please.
So I think you posed a very important question. Let me just ask, besides my friends from MLK and LA Care, raise your hand if you work at a health plan or have worked at a health plan. Just and keep your hands up. And how many of you at hospitals or clinics? Raise your hands up. Okay. For all of you that didn't raise your hands because you haven't worked at a health plan or haven't worked at a hospital or a clinic or not a physician, let me tell you, the barriers in healthcare are numerous, and you know what they are. I had the wonderful luxury of learning what even the safety net was working at LA Care, let alone knowing how a health plan works. And then at MLK. And at MLK, I was biased, but I biased because I got to stand up a state-of-the-art hospital. But in all those settings, and for those of you who have shared those experiences, I can tell you the number one barrier, not just to AI, but to any technology, to any transformation using data or IT, is this inherent medical culture that physicians' intuition and their decision-making drives healthcare. That healthcare is about revenue generation, not necessarily always about outcomes. I know we talk about outcomes. We want our patients to get better, but when you're looking at a culture, up until very recently, a volume-based culture, heads in beds, hospitals make money through the ED. When you have a CFO or any administration organization that knows that the charge master is just full of shit and you guys know what I mean about the charge master, 2013, the bitter pill, that culture has prevented not just AI, but other adoptions. I think what's changed now is 4, 5, 6 years ago, billions of dollars were thrown in, for better or for worse, into electronic health record adoption. So now there's data. Now there's opportunity for AI to work. But I think there's inherent clinical culture and a fear that AI will replace the jobs of certain types of physicians or radiologists, et cetera. And then there's the revenue challenge. So I think those are the key challenges.
Yeah.
And amongst us friends, of course, in the room, right?
Yeah, it's interesting you say about replacing physicians. Back to my guy that's going to land the plane into O'Hare. It's sort of amazing that we expect physicians in 7 minutes to do 5,000 disease states, and you better not screw it up, right? I don't see it as replacing. I did work for a long time in radiology, and what's happening there, the volumes are going up like that. And if you miss a stage 1 lung nodule, and frankly, you know, they're humans, right? So they read better in the afternoon. If anyone doesn't know that, they should. So just say it's 11 o'clock and I miss a stage 1, the computer's going to pick up that stage 1 easier than I can. I mean, I'm blind these days, but so what happens? What actually happens? Well, it's really bad news, right? So when I see this as replacing doctors, I see it as, man, we're coming to help you guys, right? And then if you see this thing as a risk mitigation platform, then you get into the CFO's office and you're going to find in the future, this is what I'm so excited about, because I hang around with too many lawyers and insurance companies. These things are going to be absolutely mandated, right? If you go into a hospital, just say I walk into the hospital and say, hey, you guys got AI, whatever the name is? Yeah, we do. Or no, we don't. And then you're not going to get any malpractice insurance. You're just not going to be able to work there. So it's not taking away the job of the doctors. It's going to actually limit the lawsuits, because my idea about the guy that gets a stage 1, we send him home, he comes back and says, hey, doc, there's still something going on here. Oh, sorry, it's stage 4 now. What do you think happens next? I can tell you, they're not getting a good HCAP score at that place. They're going to get lawsuits, lawsuits, lawsuits. All of a sudden then Aetna and United, all these guys come out of the woodwork and they say, oh boy, that's $750,000.
And I just want to add, you're absolutely right. You and I know this, and many of us that have dealt with selling technology or AI know this, but I'll use an example of a very close colleague of mine who's a CIO at a health plan. Regulations is the other barrier. He's trying to figure out, I can mention your name if you want, Tom. You know who you are. But he's asking a very important question. How do we get texting to our patients? What can we text? How can we text? So we have the regulation as a barrier as well in some cases. So I think those are the challenges for the adoption. But again, I don't want to say my position is that AI will replace any of the positions. I think it will help improve physician and nurse productivity, performance, and outcomes.
You know, just before we move on, you just got to go back to the point, 250,000 die, preventable medical deaths. So, sorry guys, we're not that worried about this, right? However, rather than dwelling on that, we are worried about the money, okay? So if all of a sudden AI is going to change a $750,000 insurance problem to $200,000, that's going to drive it. I mean, I was trying to market something called pharmacogenomics. We ended up talking to life insurance companies. They didn't even know what this was, neither did they care. And then they said, wait a minute, is that going to allow people to live 1 year longer? Because that's worth $250 billion. I don't really care anymore how we get this done, because it's not the clinical outcomes. It's people care more about HCAP scores. Sorry, the ones I talk to, oh, what's our score looking like? You know, no one's really looking at, oh boy, we buried another 1,000 people last week. It's terrible. Go ahead.
Yeah, so quick summary of what challenges and wins that we had at Tagnos. So our first customer, Adventist Health White Memorial, we went and talked about tracking patients to improve flow. They just did it because it was just simply the right thing to do, right? Because it improved the patient experience, the engagement with the family. We were on ABC News that year and all promoted by the hospital. We were in Advance for Nurses and a few other publications that year. But essentially, we had free PR come from the hospital because we did something for patient service and patient experience, a new concept. Now, it took a long while to get to where we are today, and part of the challenges were the technology and market readiness, right? So technology readiness is the RFID tags and readers were not robust. We had battery life issues. It was not cheap. It was not affordable. All of that was getting commoditized in the last many years. And then for market readiness, we struggled with the fact that hospitals were incentivized to install the EHRs, right? I mean, I read the statistics somewhere. It went from 10 or 20% adoption of EHRs to like 90% adoption in the last 5 years because of the government incentive. And obviously, we got caught in that whole tidal wave. I mean, when people are installing EHRs, we are kind of the next thing that they want to do after the EHR. So we had to wait for that sort of the tidal wave to come in and go. Even now, at some places we struggle because there's a lot of acquisitions happening. You know, Providence acquired St. Joseph. So now St. Joseph is moving from Meditech to Epic. So you know, you still get caught in those waiting game, right? I mean, and there's nothing inherently wrong with the product. It's just that the customer doesn't have bandwidth to deal with you. So those were some of the challenges. But talking about wins, we now have raw data from Keck Hospital of USC, White Memorial Adventist Health, on how we're able to shrink the cycle time by as much as 18 to 25%, depending on the service line, right? And so we've got white paper data. We've proven our concept and with a few hospitals, which are references for us. Talking about AI, because this panel is also about AI and not just IoT. So what we did along the way is that since we are generating our own data about the patient movement, right, and now we're at 10 plus hospitals, we have a lot of data coming in from different hospitals. We're taking our own IoT data, and then we're combining that with supporting data that's available inside the hospital, like the EHR, CPOE, labs, radiology, bed management. And we're able to start to do a lot of machine learning work. So for example, talking about success, we're now able to predict the case length in OR with 93% accuracy. That was a big win by our R&D in the last 6 months, right? So we took, it's amazing how your current customers are willing to share their own data with you. I mean, underutilization of data is the single biggest opportunity in healthcare and hospitals. I mean, we all know that. And once you build the trust with your initial customers, and then you go ask them for historical data, we were actually amazed at how much the CIOs were willing to share their historical data with us, because they know that the case length prediction today is very, very basic. That just takes last five cases and try to predict the case length from there. Not very robust at all. Versus we were, processing 20, 25 variables based on 10 years worth of historical data. So we have data that we can shrink the length of stay. We have data that we can predict events in hospitals using historical data. So those were some of the big wins that we had in the last few months.
So just on that, so you're on this side and you've got all these providers and plans out there. How would it make it easier for you? Like, there's obviously, you'd like to put this into another 100 hospitals. What's the barrier there? That's the reality here. Yes, we're in business, we want to sell stuff, but the reality is what you're talking about there is landmark from the point of view of these hospitals. A lot of them are running on 3% margin, right? So what's your barrier? You're sitting here, this sounds like a great story, right? But we all know that it's impossible to get into the CIO or the CFO. What do you see as you're standing there at the door? Is it education? People are frightened by AI, or what do you see that with your sales and marketing people?
Well, I mean, I think the less you talk about IoT and AI when you're selling, the better you are, right? You want to go and talk about how you're going to help them with their problems. Like in our case, what is helping us is that the market drivers changed around us in the last many years. That today, the reimbursement model for hospitals is tied to the patient satisfaction scores. That was not there when we started 5 years ago. So things like that will help you along the way. But then if we talk about the fact that we can help you with your length of stay, your departmental length of stay, every single hospital executive will agree that the dollars are tied to length of stay, right? And so if you have raw data to prove from hospital sites, then it becomes easier to sell. And over and above that, and of course, from an entrepreneur or from a startup perspective, you want to have distribution channels too. So we have Stryker and Siemens, some big name vendors out there that are reselling our product. And so when they approach a hospital, then we got that additional stamp of the brand, right, so to speak. So I think it's a combination of making sure that you're actually solving a business problem. Like prediction of case length, this actually came from somebody from St. Joseph Health System calling us and telling us they have a need to predict the case length in OR. We don't talk about AI in front of them, right? When we talk about, hey, yes, give us a few months, we'll do it. And then we go back and tell them that, hey, we can now do it with 93% accuracy. They still don't care if it's IoT or AI. If they have a problem, you solve it. And all this jargon is good for raising money with the venture capitalists. Nothing of this works when you sell to the hospital.
Please.
Yeah, I would definitely echo what Neeraj just said in terms of when we go to, so our buyer inside of an institution is typically two parties. So one is the chief nursing officer or someone in the patient experience side, but the person with the budget is generally the CIO or IT groups. And it's really about and Neeraj, as you were just saying, it's about aligning with the problem you're trying to solve and not necessarily diving deep into the technology, because if we can help with patient experience, if we can help reduce response times, which is what one of the KPIs that we're getting measured on in terms of how quickly can I respond to you, because we know there's correlation between response time and patient satisfaction, then we can help. We can help on both sides, both with the patient, definitely, but also with the caregiver. Caregivers are so stressed, overworked. The stats on the nursing and physician side, the number of employees that we're missing in the system. So there's a shortage of 1.2 million nurses. I think I was quoting a number previously about 60,000 doctors. I think that number is actually way under what the actual number is. So, and we have this tidal wave of seniors coming into the market, right? So we can't keep doing things the same way. We have to apply these new technologies in order to help us, sustain and adequately care for what's coming.
So do you have a specific win you could just sort of detail a little bit? Maybe not, I'm not sure. Just so that somebody might be sitting out there. A lot of people, I think, glaze over when they hear AI or they hear blockchain. They go, oh, that's Bitcoin, everyone glazes over. So I've heard some specific examples. If you have one, that would be great.
Sure. It's so funny. It could be something that's, we had a patient come into the room and literally they saw the Alexa on the wall and they have one at home and they said, play Chopin. The second they got into the room, this was someone playing that music for her husband who was admitted. So everything that, we started out building our own devices and then decided to leverage some of the consumer devices that are available, because there's 35 million Amazon Echoes out there, 10 million Google Homes, HomePods. So our familiarity as consumers with this type of technology is helpful to everyone. So my ability to walk into a room and know how to interact day one, and eventually turn on the lights from an IoT perspective, turn on the TV. I always relay this example. My wife gets very upset at me when I tell Siri or Alexa to turn off the lights when we're watching a movie. She says I'm modeling terribly for the children. Just get up and turn off the lights. But in a hospital, that's something where you can really benefit, or any of those other settings. And then from a communications perspective specifically, what we're seeing directly is we're able to get the right request to the right person, and therefore unburden, let's say, an RN from those blanket requests. Let those go, to someone. Cedars has an amazing volunteer program. Those can ultimately be directed to folks like that. So our ability to lift requests and make sure the right person is doing the right job can ultimately help on the other side.
Well, that's the only time his wife is upset with him is doing pretty good.
Thank you. Listen, what we'll do now is just basically go over one last segment, and then I'd like to open up at the top of the hour to questions, if that's okay. when we think about the future, okay, so the other platform I'm involved in is sort of synonymous with the epilepsy platform earlier today. As much as people might think, well, they're just doing one little part of healthcare, they might actually be able to get something done, right? It's when you go in and you're going to solve all issues, it just doesn't work. People aren't ready for that. So, but anyway, when I was working on that, I was in Boston 2 days ago, actually, and talking to people about devices. And what I found was interesting, and this is why I'm going to ask people about where they see the future in what they're doing. This is an intensive care unit platform I'm working on. $12,000 a day for a bed in New York City. You know, you could probably go to the Four Seasons and it'd be $2,000, right? So we can't afford to have the wrong people in these beds. What I found was that the world hasn't caught up yet with high frequency data. That's what I found when I was talking to these people. Again, I come from the medical imaging, and we sort of felt like we had this deep learning thing. I wouldn't say nailed, but we had a pretty good feeling for it. We weren't living in dirty data world of like EMRs and bits and pieces. But when I actually found out about the IoT world, I was interested to know that the tools are not really there as much as in the other areas, not from what we're told. So I'd love to, as we go through this, tell us about your world, where you see the future, the new technologies, and how we're really going to make a change in the future. Thank you.
Talking about predicting future, I'll just, that reminds me a story. The years ago when I started in graduate school, I was thinking about what area to work on for my PhD research. And my landlord at that time was a very street smart lady and told me, say, May, let me give you a piece of life advice. Whatever you're going to study, don't go into AI. Because I know Stanford, I know a very good friend of mine who got his PhD from Stanford in artificial intelligence, and for 20 years he couldn't get a decent job. And I myself majored in physics for my undergrad, and only then I know there's another subject on this planet that can make me even more jobless. So that's about predicting about future. Coming back to reality, what we see now is true. Because of all these connected devices, all these IoT devices, that we start to collect huge amount of data. That's part of the reason AI has been progressing so much today. And at the same time, it also gives us lots of challenges. How do we leverage these huge amount of data? And even before this whole AI thing, IT department has already been so short of staff, so short of talent, and the CIOs, the top worries about from CIOs are how we can train the existing talent to pick up the new technologies. So obviously, relying on human being manual effort to analyze this huge amount of data moving forward is not going to work. And we do see from our past about 4 years R&D, especially applying AI to IoT, we see great advantages and great results. So we are very optimistic about leveraging AI can help us do lots of save human effort from lots of tedious work, and because IoT is all about scalability, and AI can help us tremendously to scale up to billions of tens of billions of devices.
Thank you.
Forgive me, I have to stand up for this one. I have to get up on my virtual soapbox for the few moments I have. By the way, any pink sock wearing folks? Any pink socks? Do you guys know about the pink sock movement? It's a group of health information technologists that are trying to disrupt care, innovate, drink beer when they can, and get together. So I recommend looking that up. But to your question, the future of healthcare. I'm not going to tell you about what WISE is doing, because WISE is cool, and it's really cool because of the great people we have working. But I will tell you why I went to get into WISE Healthcare, which is an AI company. 20 plus years ago, 25 years ago, I created with a team of physicians, doctors, nurses, technologists, this is in the .com era, an AI tool, and we went through all the challenges. And if you asked me 20 years ago, Sajid, how would you predict the use of AI? I would have said, it's gonna It's gonna be the technology that will change how everything is done in every industry, especially healthcare, because I was a health information technologist. That was 20 years ago. The military used it. A lot of self-insured companies used it, and we learned what worked and what didn't. But you know what didn't exist 20 years ago? Or what barely was existing was Google was just starting. The iPhone was 2007. Now you look at today. All of you, every one of you, all your siblings, all your kids, even your grandparents have some form of smartphone. Maybe your grandparents have the push phone. But I know I gave grandma a smartphone, my old Samsung Note 5 that doesn't explode, to her because she wanted to do more with it, do social media. So if I had to predict what's going to happen, and I want to be very clear, we're putting in $2 million. We're launching this AI tool and service because if you're not looking at artificial intelligence in some form, in some product in your business, in healthcare, as a health plan, as a provider, as a clinic, then you're missing out. If you don't know what AI is, and if you haven't learned a little bit of what AI could be from the earlier presentation by Ash and what we mentioned, go find out what it is. Because yes, 20 years ago, AI was in a dip. In fact, AI started in 1956 at Dartmouth in a summer research program. That's when it first came out. But AI now has the tools and technologies, and in healthcare, I think this is the most open opportunity to innovate in healthcare using AI tools. It will disrupt workers, physicians, nurses, how its reimbursements are done. Now that there's so much data, as May mentioned, there's so much data with the EHR adoption, you can bet there's going to be transformation. In less than 5 years, this is what the world will look like. Not just Alexa, but on your phone or whatever wearable device, you'll be out in a park, you'll be out working out or with your family somewhere, and something will happen. You'll have an acute incident, an accident, some event from your chronic condition, and you will be somewhere not near a medical facility, clinic, or a doctor. You will do one of two things. You will press a button and talk to your virtual medical agent, your AI agent, that will diagnose you right there on the spot. 2, you will be able to push a button to then contact the doctor. The AI agent will send all that information to that doctor. And 3, there'll be a determination of whether you need care right now or not, and make that appointment to the clinic, urgent care, or direct you to the closest ED. That's how healthcare should be. It should be that convenient. And I think it's in less than 5 years away. And if you think the Amazon thing is the biggest announcement we've had this year, there's many more coming, many more opportunities. The self-insured companies, the large business companies are saying, we're going to tackle healthcare our way. So that's my soapbox. And you should be really investigating AI.
Thank you. Vote 1. Next.
You're talking about predictions, but not to brag about myself, but I have a master's degree in computer science and MBA. So the computer science part of me gets very excited when I see technologies like IoT and AI. And my MBA degree will always decouple that and say, hey, okay, what problem are we solving for the customer? So I do think that the consumerization of healthcare is real. It's happening at a very fast pace. Customer service in healthcare in the US is going to improve significantly in the next couple of years. There was an article that I read by a gentleman from UPMC that says this year is the year of patient experience in healthcare in the US. I believe that, and I believe that for several reasons. But doctors and nurses are all loving, caring people. We all know that, but they are so busy and stressed with their day-to-day activities that they don't think about customer service. And they need new tools and new ways to help them, right, to have that shift happen. And I think you're going to see that in a big way. I think what you're going to see is something like, and what we do today is we can keep the family informed with text messages. So for example, if you left your loved one for a procedure and they're being wheeled into recovery, we automatically send a text message to the family, right? It's a very simple thing to do. It's not technologically very complex. But, today there's like a nurse that's supposed to call you. And then, and if you're busy, then they leave a blank voice message because of HIPAA concerns or whatever that is. Now, if you as a family member left your patient, right, your family member for a procedure, and you're already anxious about what happened, did it go well? And then, you get a blank voice message. It happened to me. My dad went through a bypass surgery many years ago. The nurse tried to reach me, and she left a blank voice message. And then I had to literally drive to the hospital and see my dad recovering in the recovery area, right? Why should anybody go through all that anxiety? So I think just keeping people informed is basic courtesy as a human being, I think. And so that is going to happen. And if the hospitals are running behind in service lines, just like American Airlines, you will get a text message saying, hey, your 3 p.m. procedure, we can't take you in until 3:45. And by the way, if you're already on the campus, and if you're not fasting for the procedure, here's a free Starbucks coupon code, right? So things like queuing psychology. If you're waiting for something, if I tell you how long you're waiting, you feel better about it, you feel respected, right? And while waiting, if I keep you busy with the coffee, right, you feel even better. I think large health systems are getting into that whole customer service game in a big way.
Thank you.
So I think just in general regarding the future of AI in healthcare, I go back to what we were talking about a little bit earlier. When we start talking about AI, IoT, they're so all-encompassing and could mean so many different things. So ultimately, it's really about like these individual small tweaks, right? The fact that I can find a photo a lot easier of my dog or whatever it may be. It's applying this broad category of tools and technologies to specific problems because it's not some magic solution that is going to fix everything all at once. It'll take a lot of hard work. It'll take a lot of smart people solving individual problems, their problems. And so that's I guess my overall thoughts on AI and IoT. Separately, though, just in terms of vision for the future, I do believe there's going to be a little bit of Star Trek, and I'm definitely biased. I'm biased for two reasons. One is my wife's a pediatrician. I see her day to day. I see her working at 10, 11 at night, filling out charts, right? Like we've turned very, very skilled individuals into data entry people, and that cannot, again, it's not sustainable. So she can't be charting every day at 11 o'clock at night, entering data into the EHR. So I think that on the voice side, whether it's the holodeck example or before, we're going to be able to talk to our computers a lot more and talk to our devices on our phone or on our wrist or wherever it may be. And we're going to be able to leverage these tools across the board to help us with anything and everything we do in healthcare on a day-to-day experience, whether that be patient experience or accomplishing our day-to-day jobs.
So just before we go over to questions, thanks everybody for coming and great input. About 18 months ago, I was one of these guys. I love Martin Luther King. I had a dream. I really, really buy into people with a vision. But now I have a reality. When I got to meet blockchain, please research this, right? Because I thought to myself, wait a minute, all of a sudden that block can be my patient record, right, in the future. Not just for a currency, but I can actually put my genome in there. All of a sudden I've got a patient-centric, it has smart contracts, a mutable database. Oh, by the way, apply AI to that and you solve all the problems with the Ethereum platform. You can actually speed up Ethereum. So the point of this is, it's not just what we're talking about here. Try and get educated on some of this stuff because it's so exciting, because I don't just have a dream anymore. This is a reality. It's happening now. And I would get on the bus earlier rather than later. Please, any questions for any of these people?